Hi, my name is Morgan. I'm going to be a student nurse today. I have orders from the doctor to administer IV fluids. Can you verify your name and date of birth for me?
Joe Smith, 10/12/1943.
Do you have any allergies?
No.
Check your wristband, make sure that's correct. I'm going to wash my hands, close curtain for privacy. And I'm going to verify that the physician orders are the same as the MAR. So we have IV of normal saline, 1,000 milliliters. IV normal saline, 1,000 milliliters. Then we have normal saline flush, 10 milliliters. Normal saline flush, 10 milliliters. Alright, so we have that. And now I'm going to check for phlebitis in your veins, on your catheter site, your IV site. And that's inflammation of the vein, so it would be red, swollen, warm to the touch, and you don't have any of that, so that looks good. And then make sure that your IV is not more than 96 hours old, and we want to change it if it was getting there. And now I'm going to do my first check of my medications, the MAR medications. So IV normal saline, 1,000 milliliters. So IV normal saline bag, 1,000 milliliters. Normal saline flush, 10 milliliters. Normal saline flush, 10 milliliters. And then I'd also check the integrity of all the packages and make sure nothing's open, discolored. And this would be in a bag, but I demolished the bag practicing. So, but out of the bags and packaging, it looks good. And I'm going to do my second check against the MAR. So 1,000 milliliters, IV normal saline, 1,000 milliliters. 1,000 normal saline, 1,000 milliliters. Normal saline flush, 10 milliliters. Got that here. And you also want to make sure nothing's expired. Okay. And now I'm going to do my 5 patient rights. So right patient, right medication, right dose, right route, right time. Now I'm going to do my third check against the medication to the MAR. IV normal saline, 1,000 milliliters. IV normal saline, 1,000 milliliters. Normal saline flush, 10 milliliters. Normal saline flush, 10 milliliters. Okay. And I'm going to show you my correctly rated rates. My hourly rate is 1,000 milliliters over 10 hours, so 100 milliliters an hour. And we don't have a pump, so we're going to do the drip rate. So we calculated that to 25 drips a minute. And divide that by 4 because I'm going to time it over 15 seconds. So about 6 drops per 15 seconds. Now I'm going to put my gloves on. Open my IV bag, and I check the package, expiration dates on everything. And I want to make sure my clamp is closed, which it is. I'm going to go ahead and puncture the bag. I'm going to open up, that slid right out. You don't want to touch that. And I take the cap off of this, and this would be sterile. And then you touch like that. Okay. I hang my bag. I'm going to prime my tubing. So these you want to hold up. You want to make sure that this is about half full, so squeeze that. So we're able to prime our tubing. Open the clamp. Water's coming out. I'm going to flick it a little bit to get all the air bubbles out. There's no air in the line. Close the clamp back up. Okay, so I got that. Now I'm going to flush the IV. So I want to make sure that this is taped securely. Gonna cleanse this for 30 seconds. So 30 seconds. And we're going to use the push method when doing this. You want to aspirate for blood first to make sure that that's still in the vein. And then you want to use the push method. And you're checking for infiltration when you're doing this to make sure that the IV catheter is still in the vein and it's not leaking fluid on the tissues surrounding. This also cleans out that catheter. Okay, I'm going to leave that sit there. What am I doing? So now we're going to take this off. I'm shaking so bad. Okay. Clamp that in there. Make sure that's securely taped so the IV doesn't have a chance to come out. And now I'm going to calculate. I'm going to take off my gloves now. I can do that. Now I'm going to make sure that there's 6 drops infusing over 15 seconds.
So I didn't know if you wanted me to stop you or not. Yeah. Okay. Do you want me to stop it completely then? I was like, maybe she'll sing it.
Let me count.
Otherwise, am I doing good until? Yeah.
All right. So I got 6 drops over 15 seconds. And then I would take my tape, label my tubing and my bag, put my initials, the time and the date on there. Ask the patient if there's anything else I can do for them, clean up, and document my findings.